Welcome to episode 2. Welcome back to episode 2 of the Biological Sex series. Today's episode is going to be revolving around the topic of intersex. Let's define it first. Intersex is defined as a person who is born with some biological characteristics that are considered male and others that are considered female. It's a term generally used for a variety of conditions in which a person is born with a reproductive or sexual anatomy that doesn't fit the typical definitions of male or female. Oftentimes, the sex of an intersex person will be decided by performing a surgery, only if the external genitals are not obviously male or female, to assign the baby's sex, as it is a legal requirement for this birth certificate in most countries. Awareness of intersex conditions are growing. In the past, when a child was born intersex, their doctors and family would decide on a gender and raise the baby as that gender. It was common for surgery to be performed on the baby's genitals and for the child to be given male or female hormones as they went through puberty. But of course, sometimes the gender that the family assigned the child at birth doesn't match with the gender identity the young person grew up to have. More and more people today believe that the unnecessary surgery and other medical interventions should be postponed until intersex people are old enough to decide for themselves what gender they identify with and what, if any, treatment they want. So now that we defined what intersex is and how in the past families and doctors would decide on a gender role for their child, but like one's gender and attraction, there is more to being intersex than having extra chromosome or different genitalia or hormones. An example of an intersex condition is overtestes. Overtestes are gonads, the sex glands, that contain both ovarian and testicular tissue. This is sometimes in place of either one or both ovaries or testes. For example, a person might be born with 2 ovotestes, 1 ovary and 1 ovaroteste, or a different combination altogether. This won't tell you what the person's genitals will look like when they're born. Some look fairly female, some look male, and some in between in terms of genital development. This has concluded season 1 of Biological Sex and the Becoming Equal project. In season 2, we will be diving into gender identity. We hope you enjoyed these videos and they gave you some insight into what the biology of your body is and someone else's. See you next time.